Hi, and welcome to another episode of the Healing Lyme Summit. I'm your host, Dr. Mariah Hinchy, and today I'm excited to talk about True Dose IV therapy. This True Dose therapy is a patent pending regenerative treatment that harnesses your body's ability to heal itself using platelets and actually platelet rich plasma. So, when given at the right dose, which is the key point, it can activate your immune system to stimulate the repair process in the body and decrease inflammation. So, we are so lucky to have with us today the creator, founder, and owner of True Dose, Tapley Holland. Welcome, Tapley. Tell our listeners a little bit about yourself and how you came up with this procedure.
Well, my background is in stem cells, and for the past 20 years, and we can all agree that we were created with this ability to heal ourselves from cells within our own bodies. And I got to see that over and over. But I also got to see, cases where people didn't respond. And so the question is why do some people heal from these therapies, and you have these miraculous stories, and why do some people not even respond? And the question really goes down to a dosing and accuracy problem. And what I mean by that is that if you look at the scientific literature and if you look how any of these therapies are administered, whether it's umbilical cord stem cells, platelet-rich plasma, bone marrow stem cells from your own body, we do the same thing to each individual, the same thing. Um, and then we don't know the dose that we're giving them, but we expect some sort of response. And that's how all the literature has been reported over the past really 3 or 4 decades. And what I said is we need to be determining what is the dose that is required to heal this condition or that condition, which led to me in a full disclosure. I had a dream one night, and this intelligence was downloaded to me. And within that dream was all the software and artificial intelligence to create a software that would be able to determine the dose response relationship for all of these therapies um, that could possibly ail us. And what I did not expect was, because I created that technology, and when I started, I said, we need to start with things that people can understand. We need to start with our own blood. Uh, and because people can understand blood, it's from you, it's very simple. And I started with things like make my knee feel better and make my hair grow. And we solved that problem. These conditions, which largely take 3, 4, 5, 6 treatments to have some sort of response, did not need to have that happen. On the first treatment, if you knew what the knee dose was, the make my hair grow dose was, the hair grew or the knee got better and resolved in the first try. What I did not expect was I had a very similar type of download, and this information was, let's try to do this intravenously. Let's try to do this intravenously because I was trying to heal a child of mine, my fifth child, who was autistic. And I called my wife and I said, I think if we do this intravenously, I think if we jack up the dose, I think this is going to turn your brain on. And I think this is how we're going to heal our son. And to make a long story short, like any mom who's taking care of an autistic kid, she is going to be the test pilot to try that therapy. And if it helps her, she's going to do it. If it doesn't, she's not going to give it to the kid. And I had to, really lay the evidence out in front of her dad, who's a medical doctor. He's an MD, and as to why this would be a good idea. And when he finally said, okay, we'll do this, the next morning after we treated her, it did everything I thought it would do to her brain. And then it did things that I never even thought were going to happen. Her cognition, her vision, the tinnitus in her ear literally melted away instantly. Her body changed. Her stress incontinence went away at week 3. What all these signs I did not know at the time that were happening to her were signs of massive detoxing, massive detoxing. because she suffers from breast implant illness. And um, the second patient was my second child, because at this time I didn't know, you know, that we had something here. The second patient was my second child, who was borderline dyslexic, very disorganized. I hope she doesn't listen to this podcast. And we did this treatment to her. And to make a long story short, uh, a month later, when she started school, her reading went from below grade average to mastery. Her organizational skills went from very messy to hyper organized. Uh, Her whole brain was rewired. Now you flash forward to today, and close to 10,000 patients later, I can tell you that taking your blood out, using the TrueDose technology to create a dose specific therapy, which has now become the TrueDose IV platelet therapy, has led to us uncovering a treatment that really can, like you said, can kickstart the immune system repair system, and in some cases have complete resolution of conditions and diseases that conventional medicine deems not treatable.
Yeah. So, for our listeners that don't really understand yet what, platelet rich plasma is, or even what platelets do in the body, I think a lot of people, we've all heard of stem cells. So, why don't we start by, comparing like what a stem cell treatment would do to what PRP is, or at least, tell the listeners what are platelets, how do they activate the immune system? Like, what is the physiological process that this is going to stimulate in the body?
So let's start with, you know, how do you create it, right? So you take a volume of blood from your arm and you place that into a centrifuge to separate the components. All right, this is how you create any stem cell therapy. You take a volume of fluid from you put it into a centrifuge to separate the different cellular components based on their weight. And you do that maybe once, maybe you do it twice. And once you process it in a centrifuge, you're left with a small fraction of, let's call it, stem cells. And in this case, you're left with platelets. Okay. So the process can be analogous to taking a jug of orange juice and you want just the pulp. Centrifugation is the process of extracting just the pulp and maybe adding a smidge of water to it. And the more water you add to it, the more diluted it gets. And that's where the idea of concentration comes in. So platelets, unbeknownst to conventional wisdom, if I asked you right now, not knowing what you know, what do you, if I asked you what do platelets do, what would you have answered before you met me at Ben?
I would say they're there for blood clotting.
There you go. And that's what we've been taught, is that their main purpose in the bloodstream is to make sure we don't bleed out from paper cuts. But in fact, platelets are the one thing circulating the bloodstream, surveilling the bloodstream, looking for two things: repair needs and defense needs. And whenever it encounters either one of those, it activates our repair system and our immune system. And these are non-debatable facts. Um, and whenever they initiate the repair system or the immune system, each one of those two systems, the balancing of those two things is how we live a long life. So the repair system or the immune system is really a sequential, orderly process on how we heal everything or really clear out a virus or a bacteria. Um, and so the platelets start both of those processes. They oversee it, they coordinate it, and in some phases of those steps, they are specifically responsible for some of the activities. How this differs from stem cells is that whenever I heal something, there are several steps that have to happen in the repair process before stem cells are even called into the equation. So the analogy I always give, and there's nobody who's pro stem cell more than me. Um, think of stem cells as like the trim guy or the painter of building a house. You have to build the foundation, you have to build the structure, you have to build the plans. Before you call in the trim guy or the painter, they're called at the end. Platelets have to really set this whole process up before you call stem cells in. And so the challenge and the problem with stem cells is not that they don't work, it's that they're too frequently given at the wrong time with people with chronic inflammatory diseases. And so the body says, I don't need stem cells right now. I'm not ready for them, but you're giving them to me. And so that's why they're rendered useless. You give platelets, and what it's doing is it's restarting your repair system and restarting your immune system to begin again.
And then in the end, when it's time, the PRP will draw your own stem cells, right? Like it will cause an
Yeah,
increase in stem cells, but at the right time when your body can actually utilize them.
that's actually a great point because that is, when what you're saying is that whenever we get injured, the body takes some of our stem cells and it puts them over here to the side purposely so they don't get injured by whatever the response, the pathogen, the trauma is, and it keeps them safe. And it keeps them safe purposely until it's ready for them. So, and what platelets do, and there's evidence on this, that you restart this process to begin again, and it brings those stem cells back into the game. It brings them back off the bench. So, um, but the trick is you have to do it at the right dose. If the dose for you and for your condition is not going to be the same dose for me. And if you don't do the right dose, you will not have the response.
So is the dose I hate using the word disease, but I'll use it in this instance. Is it disease or infection, like infectious organism specific, or is it like patient specific, depending on what's going on with their platelets and their immune system? Or is it more like a kilogram of weight? Or is it all of those things taken into effect?
Actually, it's both. So actually, it's both. And no one's ever asked me that, but it's actually both or all three. When you're dealing with children, it's actually by weight, but it's also by dose. Okay.
So
When you're
condition and weight is
that's
is
right.
how you get your dose.
When you're dealing with kids, because
Yep.
there's only so much blood within a child versus an adult.
Right.
But the dose. So let's start with the dose for a disease specific condition is the dose. So the dose for the knee is the knee dose, whether it's for you, for me, or for somebody else. But what I'm going to do to you, in this case, how much blood I need to draw from you is going to change. So it might be 155 mils of blood from you. It might be 33 mils of blood from me because we're biologically different. And that's the key. Um, and but we both have a knee condition. And even though what we do to me and you is different, we still get the same knee dose or the Lyme dose or the lupus dose. So this totally is radical compared to how we've done stem cell therapy treatments in general because you take two people with the same condition and they're going to draw the same amount of blood from both of them and expect them both to have a different, outcome result response. And that's why the TrueDose technology exists. So you have a disease specific condition dose, which there's, I think, 60 plus disease conditions that we've kind of figured out over 10,000 patients. So there's that. And there's also, you brought up weight, and that only comes into the case with kids. So
I was just going to say, and to clarify for the listeners, because this was a little confusing for me until I sat there with you and watched your team processing the blood. So the dose is like you have this initial amount that you're going to actually draw from the patient that you think is going to get you kind of like to your platelet dose. But then you run it through your software and you see like how many platelets you get from that particular person's blood draw. And if you don't have enough, to get to that true dose range specific for that disease, then you might need to draw a little bit more, correct? And get more platelets so that you're getting them into like that therapeutic range for the disease that you're pinpointing, correct?
right, what you saw them drawing blood, what they were doing is they were taking a small sample of it, just a few drops, and they were analyzing it. And then once that measurement came back, then they imported that into the software to determine, okay, what do we need to do to you Mariah, right? And if they came back and drew more blood, it's because that's what the software called for. Um, and you know, you know, if again, if everybody's, kind of like you saw a patient, when you were sitting in that room, a friend of yours, where the first time you saw him get a treatment and he had way more blood drawn than he did, let's say, last week when he had less.
Hmm.
So, but guess what? In both instances, he got the same dose because the treatment we were treating him for was the same. So, uh, there's the case in point where you don't want to overdose somebody. You don't want to, obviously, you don't want to underdose them. And that goes right to the heart of the true dose.
Right. So tell the listeners a little bit about the safety of this because I can't imagine, right? You're taking your own blood and putting your own blood back in. So it's got to be a very low chance of having like some sort of reaction to anything, right?
Yeah, I tell people that, like my wife was patient number one, right? And then, now, because there was no reported literature on doing what we were talking about, taking platelets out, infusing them back in at dose concentrations that the literature doesn't even report or has even conceptually thought was possible. If anything was to be reported adversely, I would have heard about it. And what I can tell you is that to date, to my knowledge, there's been no adverse reports reported. In fact, it's quite the opposite. It's very rare that we don't hear somebody respond positively from the treatment, um, no matter what the treatment is, whether it's stroke or whether it's Lyme or whether it's lupus. Um, it just might not be what that individual was expecting that they wanted to happen. Many people come into the treatment, for example, having Parkinson's and having tremors, and they want the tremors to go away, and that is their expectation. That's what they have in their head because that's the glaring thing that they see at that moment. But the way this treatment works, which probably what we'll end up getting into, is uh, is that's not how the body heals itself, and fixing the tremors might be the result of four or five other causations that are wrong in the body. It's just manifesting itself as tremors. Um, so the fun thing has been helping patients recognize when healing is happening and recognize the fact that all these little things are signs of healing, and that's the result of the treatment. That's the result of this treatment helping the body heal itself.
Right. So do you see a lot of Herxheimer reactions when you are administering this to people?
You do. I commonly hear and report from doctors and patients alike that this is one of the there's nothing that quite detoxes like this treatment. And I don't know if it's necessarily that, but more the fact that um, I would say there's nothing that probably gets the body working at one given moment more than this treatment. You go from somebody who's metabolically not working and dysfunctional, and all of a sudden, at a given moment, they are working and everything's turning. So the liver, the kidney, the colon, everything just starts moving, and it may look like they're detoxing, um, but it's not. It's more of like everything's working now. As far as herxing, um, it's it's very common with people with chronic metabolic diseases that are predisposed to all the stuff that's floating around. They're going to herx,
Yeah.
and we have protocols in place, and obviously that the provider's discretion that can minimize that herx. Um, but I've stopped calling it herxing. I've started calling it healing crisis. That's the term that really I identify with. That's really what it is. It's getting all this stuff out of you, and yes, it's unpleasant, um, but that's the body working again. And does it happen to everybody? Let's say two people with Lyme disease. No. For the first treatment, may you just see all these gains and this energy and the sleep. Second treatment, you might see that Herx reaction, but there's days, good days, there's bad days. But and eventually that Herx goes away uh, each successive treatment.
Yeah. Well, and I would say too, like a herx really, like how much someone is going to herx when you're killing any sort of organism in the body is really a balance between how well are they detoxing, how open are their routes of elimination, and how quickly are you killing the organisms. So if you can kind of coordinate that die off with their ability to optimize detoxification and elimination, you're going to see way less herxing. So yeah, there's a lot that goes into, I would say, preparing the body to get ready to receive any treatment. And the more prepared they are, the less herxing there's going to be.
Yes,
So
go ahead.
no, I was just going to say, so why don't you get into like the physiology of how this is working in the
How
body?
we're the, everything I'm going to say, because it's such a counterintuitive. You're taking blood from me, you're taking it out. I get the whole dosing, and you're putting it back into me, but it came from me. How is it working? And um, I'm going to give you the three ways, and this is how it's happening. Your body manufactures platelets on demand based on real time disease state. And the second that I take blood from you, a volume of blood from you, your body is immediately replenishing that physiological loss of platelets. So by the time you've sat in a chair for 30 minutes waiting for this treatment to be created, you've already replenished that population of platelets that you've lost. So you're back at baseline. And then you put in this huge amount, this dose specific, condition specific, back in your bloodstream. And now your body says, oh my gosh, I have all this excess. Well, go start fixing things. The second thing has to do with your body regulates itself. What we've seen with many, many blood panels, many things, that your body regulates itself at ratios. And this is stuff that even the Greeks saw this with Hippocrates, that the difference between health and disease is the body's ability to maintain ratios of bile, two types of bile, phlegm, and blood. And whenever they saw that any one of those four things were out of balance, disease happened, pain happened. And that's exactly what happens here, because when you take blood out and you remove, let's say, red blood cells, let's just keep it simple, through the centrifugation process, and you put back in this crazy super amount of platelets, you've dramatically altered the hemodynamics of everything in the bloodstream: cells, hormones, transmitters, bacteria, everything that's regulating health. And you put this massive amount of platelets in, everything will start to shift and change. Everything will start to re-ratio out as it recalibrates your body. And I can say that because if you measure someone's blood at baseline and you measure them, let's say 10 days later, their their CBC count is going to be completely altered. And it takes about 90 days for that to normalize. And then you have just new normals: thyroid lowers, this and that raises, enzymes, everything. The third reason, it's probably the easiest one to grasp, is the fact it has to do with, your body, as you acquire these conditions, Lyme, lupus, those are the result of many, many things stacked on top of one another over a lifetime, right? They're inflammatory insults that are simply unresolved. That's how the body sees them. Is there's problems I have to get to, and I need to make a priority for it. And when you take this out of the body and you put it back in, that whole priority is reset. That whole, what the platelets are seeing, is reset, because the platelets are the ones coordinating all the dynamics within the bloodstream and getting real-time feedback as far as health and disease at any given moment. When you take them out and you put them in this blood bag right here, let's say, or these syringes, they're not being stimulated or being communicated with anything in the body. And you stick it back into the body, and now it has all this information. And the technical term is your immune system recognition and your repair recognition is reset. So now it's able to determine priority. What do I fix now? It's able to determine priority of coexistence. Virus, you're not living with us anymore. Bacteria, you're getting out of here. Um, and so it starts to heal the body in really an order and how, in a reverse order, how it turned the body off.
Yeah, so one of the, well, I would say the two biggest issues with chronic tick-borne disease or chronic vector-borne disease is that it causes immune dysregulation and chronic inflammation. And so it sounds like this would be a really good adjunctive treatment because, it's kind of tackling and helping to normalize the two most important pillars of treatment, at least in my mind, when you're dealing with these infections. We have to decrease the inflammatory cytokine cascade, decrease these organisms' ability to break down our tissues and feed from them, and then normalize the immune system so that in the end, it's able to hold these infections in remission. And you're saying that this treatment is going to be able to aid in those two areas.
That's right, because I said earlier that your body heals itself and defends itself in a sequential, orderly process. And at each of those steps, as it heals or defends us, it has to make sure that certain things are satisfied at a cellular and organ level before the body will let it go on to the next step, into the next step, and the next step. The problem is that the body doesn't see this as having Parkinson's or lupus or Lyme. It sees it as, I have a problem. I'm trying to fix right now. And I'm going through step one. I'm going through step two. I don't have everything I need. And so what happens is we get stuck at a particular step, and the body will not let you progress forward until you have whatever it is, which is another conversation. And so until it has what it needs, you'll get stuck in this feedback loop of inflammation. And so that singular problem will lead to another problem and then another problem. So you put this back into the body, and it simply says, okay, where's the priority? Let me go start with this, this, and that, and let me give you what you need. Because the platelets, for example, the platelets carry around 95% of our body's total payload of serotonin. So if you need detoxing, you have to have the liver. And if you look at any of the literature, serotonin is the one hormone that helps the liver regenerate. What about brain-derived neurotrophic factor? That's something, if you have any type of sensory loss, fine motor loss, you're dealing with any neurodegenerative condition, you have to have that because that's how we regrow nerves. Well, guess who carries around 99% of that? So the platelet carries around all these different things the body needs and hands them out to the cells based on what they need at that particular time.
So
So
how long are you gonna have that increased level circulating, working before the body degrades it, and then you need your next dose?
that's good. So it takes about a month before you have, let's call it, the half life of the platelet. It's constantly handing stuff out at about a month. Um, but as it hands it out, all these little repairs that's happening will continue to happen for about 8 to 12 weeks.
Okay.
Okay. And whatever those repairs are based on you. So start turning the thyroid on, insulin numbers start to, go down, liver uh, uh, enzymes start to improve, all types of things. All those things start to happen at about the 8 to 12 week mark is what we've seen the body start to plateau. And what's happening there at a cellular level is that those improvements are metabolically imprinted in the cell. It takes about 3 weeks for something to recognize it, 3 days for it to recognize it, 3 weeks for it to be kind of etched in the cell's memory, and it takes about 3 months for it to be permanently stamped. And that improvement's locked. That's your new normal.
So as far as like treatment intervals go, then does it make sense to try to jump on right around 4 weeks when the levels are starting to go down because the platelets are getting naturally degraded? Or do you wait till like that 8 week period where you're still going to be seeing like these, these benefits happening? Or do we wait to the 12-week period where they're starting to get stamped in permanently? Like where's the optimal
Eh,
point of intervention to repeat the therapy?
8 weeks,
8 weeks.
8 weeks.
Okay.
That's actually, we didn't talk about these questions, but you're obviously coming up with like really good questions on the fly.
Well, these are the things I need to know to treat my patients.
Well, because people ask, there's really, can I do it again? Can I do it again? Can I do it again?
Yeah,
And if you have a neurological condition, you have TBI, you have cerebral palsy, you have stroke, those are pure neurologic. You could do it every 4 weeks if you were just that ambitious. The reason you don't is because many of these conditions we see are neurological symptoms that are the problems of metabolic dysfunction and herxing. And so if you keep doing this treatment every 4 weeks, if you have Lyme and metabolic, you're just going to keep shaking yourself and just it's going to be just bad day. You're just going to keep herxing and herxing and herxing. So you got to give that period to let yourself calm, the body calm down. And that's about the 8 week mark. And I say 8 to 12 weeks because it's that window. It's hard for me to tell when somebody's a fine line, but that 8 to 12 week window is when you need to. It starts to plateau and when you need to hit it again. And if you wait too far past the 12 weeks, I mean, sure you'll keep those improvements, but if you just do just one treatment, which we say, listen, don't do this treatment if your sole intent is to do one, because your body can metabolically relapse
right.
and it's wanting to go back.
And the way I'm, correct me if I'm wrong, but I think that in my head, it's like, okay, say that you sustained an injury and you get one treatment. Like you might be better off with that one treatment or two treatments than you would be with no treatment. But if an infectious organism, if you have something living inside of your body that is constantly creating inflammation, immune dysfunction, breaking the body down, like clearly, one treatment might give you like some temporary relief, but like unless you go through this series of treatments and by the way, you get rid of that infection, you're not going to hold those treatments because the infection is actively breaking you down. Is that kind of like a correct way to look at it?
That is the way to look at it, because
Okay.
because the things that you're talking about have made a permanent residence in your home, in your body, and um and they're not going to willingly want to go away. And these it's not temporary. I mean, these reliefs that you're getting from a singular treatment, I mean, they're big shifts, they're big, huge gains. But you're also, let's take Lyme for example. I would say the first treatment of Lyme that people typically have these great shifts in energy, these great shifts in cognition. Typically, you don't see a massive herx. Typically, with Lyme. And to me, it's because you're getting all of this Lyme that is really line of sight for the immune system to fight within the bloodstream. The second treatment is when you really see that really big herx, is because you've cleared out all of the stuff that is problem child in the bloodstream. And now the stuff that has been living in the tissues, living in the cartilage, they're next. And they're not going to want to go away. And so it's really going to go after that. And you're really, if you hear the way patients describe um, the second treatment, let's say specifically with Lyme, it's almost like it's being chased around the body. It's almost the way they describe it. It's like, I feel it getting me here. Now I have new pains here. I feel like it's chasing it. And, uh, and so obviously this stuff is going to try to make a residence somewhere else in the body. And, but eventually you will get it. You will get it, all of it.
Right. So, are there contraindications for this? Like, so for example, I would say in my line of treatment, one of the big contraindications is if a patient is on blood thinners. Are there any, medications, or conditions that you would say would be contraindicated with using the TrueDose IV?
No, no. I can say that the only condition that has been reported back to me by any and all the providers that is, I would say, given pause, that's saying, let me double check on that. And that wasn't to me, but that was to themselves, was somebody who had a valve replacement, a heart valve replacement with a xenograph.
Mhm.
And that was just because of maybe rejection, maybe because it was, from an animal. But that's the only um, condition that I can even recall that has even given someone pause. Everything else, what if I have low platelets? What if I have clotting disorders? What if I have, this and that in the bloodstream? It's I nothing has given pause to any of those types of conditions, which are typically frequently asked questions.
Yeah. Okay. So, is there anything else that you want to include or talk about regarding like how this treatment works in the body or the logistics of the treatment? Because I know that you have a patient there with you,
Yeah.
that's going to share some of her experience. So, anything else that you want to touch on or talk about before I
Well,
have you introduce her?
yeah, I was going to give you an example just so people can hear um, maybe what this does. And
Mhm.
and and I would say I would segue this into saying what a tremendous impact this treatment has on kids and pediatrics, simply because their immune system and repair system hasn't been taxed over a lifetime of living like the adults. And so their response is profound. Um, and I was going before I hand it off to her, I was going to give anybody who's listening just to get an idea on, well, I understand how it works, I understand what it's doing, what can I expect? And this is something I got last night. This is from a mom who her, herself, she has Lyme. She treated herself. Her gains were great, but her son has PANS and PANDAS and also Lyme. Okay, and this is after his first treatment. She says more communication, more engagement, more awareness of how sick he's been. It's more like, oh my gosh, I've got my stuff together now. He's displaying more gratitude. He's asking more to do the chores instead of begging me, or instead of me begging him. He's got more funny, joking behavior because that's really who he is. Um, he's having more fun with his siblings. He's saying, "Mom, guess what? You don't have to remind me to take my supplements." He's singing a lot because he's a really gifted musician. And so to me, that means his soul is coming out. He hasn't even worked since June of last year because of his autoimmune encephalitis, but now he's going back to work. So he's had all of these gains that is he walking better? Is he seeing? Or these are all like, these are all like, aha, yeah. But when someone's having these emotional shifts and these demeanors, uh, that's that shifting out of that sympathetic fight or flight that people have been stuck in for a long time. And I would say that that's probably the one thing I want to get across, that this would help people the most, is helping you enjoy life again. And we hear that, what I just read to you, all the time.
Yeah, it's so important to deal with that dysregulation of the nervous system and get patients out of that constant fight, flight, or freeze in order to get the immune system functioning properly again. And yeah, I can say my experience with TrueDose, there is definitely an emotional shift, even when you think you might not need it. But there definitely is, and it's amazing. And it's not for me, and I didn't have any real reason, let's say, like a disease that I was doing it for, just more like optimal health. And again, I typically won't do something with a patient that I haven't been through myself. And I gotta say, like the way that you feel after doing this, and for me, it lasted the first time for weeks, and I'm still kind of like in that right now. Is just like this amazing enhanced sense of well-being and just happiness, and yeah, there's like a lot of gratitude. Like it's amazing. So
Well, I don't want to steal, any more time, because who I want to introduce is someone who's an important. She's not only an incredible testimony, but she's also become just a invaluable asset to what we do and why True Dose is so important. And her name's Elena. So I'll introduce you to Elena and let her tell you about herself, because she is a patient. She's There's nobody. I can talk about Lyme. I can talk about what it does because I've sat in front of thousands of people, but I've never lived with it. I may have an autistic son, but I've never lived with chronic disease. And so, but she has. And I think her perspective is invaluable for people to hear her journey, and then, what to expect and what to do.
great.
Transfer here. Higher chair. Hello.
Hi, good
How
to
are
see you
you?
again.
Good to see you too. Great to be here.
So
Yeah.
share with our listeners your experience.
So I found True Dose about a year and a half ago, and I have, I was misdiagnosed with Lyme, and it wasn't until 2019 actually that I was finally diagnosed. And I had been dealing with this for decades, along with a whole other slew of autoimmune. But for me, the Lyme was where everything really resonated. And I was dying. I was cognitively so impaired. My pain was off the charts. They really thought fentanyl patches was an option, but I wouldn't go there. And I had written my kids letters. I was tired of hiding this because that's what I had to do to continue to go on. So this was introduced to me, and I sat on it for a couple months. And then I finally said, okay, we'll go back to the Lyme. And so my first treatment, I I was preparing for, invasive treatments and all these things because I'd been put through the ringer with different things. It was non-invasive, and took an hour, and I had instant results. I had a happy, the soul level come over me that I never was able to let go of, and a gratitude that instantly shifted for me. Um, my Lyme symptoms have completely gone away. I'm not symptomatic on any front on any of my chronic disease and issues anymore. The pain was about 80% gone by week 3. And I had bone pain, joint pain, tissue pain, skin pain, you name it, pain, I had it. And here I am a year and a half later. I'm working full time, and it's intense work. Traveling, I don't know, sometimes 3 weeks at a time. And so my energy is better. If not like when I was in my 20s before I got sick. And I can track this back to early 20s at this point. And now I'm 53. So I lived with this for a few decades.
And so how many treatments have you had at this point in the past year and a half?
So I do these treatments every 8 weeks, and I still do them. I would say I've probably had a dozen, because I was in bed and I was not able to function. And I won't ever go back to that. So for me, being able to do this once a quarter, I would make it happen. And because of what I'm exposed to now, I do it to make sure I stay healthy.
Yeah, I I would
right?
imagine going, getting out of that, and then you're like, "I'm gonna do anything I can to maintain this." So,
Yeah. Yes. Yes. So, from the standpoint of, this gratitude, and you were speaking about it earlier that you've experienced, and Tapley was talking about it. I really find it's the body recognizing hope for the first time for being so, so sick. And even having the HERS reactions that I had them, after my second treatment for probably mine lasted 8 weeks of kind of this up and down, up and down. Um, but it's you can hold on to getting better, and then what do you do when you get better? And I think that's a whole nother conversation to have. But this really brings you back to hope and faith and things that when you're chronically ill, and especially with the Lyme symptoms, it takes over. It becomes who you are. And this has really given me the ability to no longer be a Lyme patient. My blood work is coming back clean. My markers are dissolving and disappearing. So it's pretty amazing.
it's wonderful. I'm glad it helped you so much.
Yeah.
Anything else that you wanna share with the listeners that you want our audience to hear about True Dose?
I think it's one of those things where whenever you get into something, it's you have to trust the process, and you have to listen to your doctor talk about from the educational standpoint, and just know that this is really the body healing itself. And when you're given what it needs, it really can do it. And it might take multiple treatments, and I've had a lot of them. Um, but there's something magic to the body being able to heal itself.
Yeah. So, how would a listener, find True Dose?
Well, you can find us. We're in clinics throughout the U.S. We've got a great website that has all of our providers on it. So through the website, and I don't know if you link that, or that's probably the best way. And it's
Okay.
trudosTherapy.com.
So, there's a find a provider link or
Yeah,
something like that
yeah,
on the website?
yeah.
Okay.
And we have a portal that you can email us, and we can connect you directly with one of our providers as well.
Okay, great.
Yeah.
Would Tapley like to say any closing words or give any pieces of advice before we end the interview for
I
today?
think I think so. Here he
Okay.
comes. Thanks.
Nice to see you.
Good to see you.
Hi.
Hi.
Closing thoughts. Um, this doesn't take the place of doing all the other therapies. This works right in the middle of all those therapies. The infrared sauna, the EBU, the ozone. This whatever those therapies are for your specific condition, this goes right in the middle of it. Um, and so that's where. But what it does is that it allows you to work with the provider because you feel like you're in control of your health again because you're healing, and the provider is able to really navigate. Okay, we need to get you off this supplement, or we need to do this therapy to keep the therapy going. So I don't want anybody to take away that this is definitely a big piece, and it's awesome, but it doesn't take the place of all the supportive things around it, and it doesn't mean you can stop doing those. And but it allows your provider to heal you, in many cases more expeditiously, just because you're able to become more aware and in control of what's happening and what's healing, and they're able to say, you get off this supplement, we need to increase this one now, oh, this is working, let's do this. And so and I would say that's probably one of the biggest things is patients feel like they're in control for the first time. So
Yeah,
that's about it.
that's great, and it's really important, and yes, like, this is an adjunctive therapy, that should be part of a well-rounded holistic approach to, to whatever the infection, disease, condition that the individual sitting in front of us has. So
Correct.
wonderful. All right. Well, thank you so much for joining us. And thank all of you at home for listening and being here. I hope that this information has helped you on your journey to healing Lyme. We'll see you next time.